for the meeting of the Social Work Resources Committee on 15th February 2023. I have in the meeting Councillor Alex Allison. I have apologies for Councillor John Bradley. I also have present Councillors Walter Brogan, Robert Brown, Arch Buchanan, Matthew Buchanan. I have apologies for Councillor Caliques. Also in attendance I have Councillor Maureen Devlin, Mary Donnelly, Councillor Fagan. I can't see Councillor Fagan's in the meeting. I don't think Councillor Fagan's in the meeting. We also have present Councillors Faulkner, Councillor Frame, Handybode, Horn, Horsham, Councillor Hose. Can you indicate if you're present? Can't see Councillor Hose. Sorry. Oh, sorry, I didn't know that. Okay, Councillor Hose is not in the meeting. And we also have present Councillor Johnson Dempsey, Eileen Logan, Hugh MacDonald, Catherine McClymont, Councillor Nelson. Can't see Councillor Nelson is present in the meeting. We have Councillor Nelson present in the meeting. We also have Councillor Nugent. We have apologies for Councillor Ross. And present we have Councillor Graham Scott, Margaret Walker, David Watson. We also have Councillor John Anderson substituting for Councillor Bradley and Councillor Maureen Chalmers substituting for Councillor Ross. I also have in the meeting Councillor Richard Lockhart. Councillor Lockhart, could you indicate who you're substituting for in the meeting?
Martin Hose.
Sorry, Councillor Lockhart, I didn't catch that.
Martin Hose.
Oh, thank you. Thanks. Okay. I'll now hand back to the Chair. Thank you.
Thank you, Tracy. I'll move on to item 1. Any declarations of interest? No, thank you. Item 2, minutes of the previous meeting, pages 5 to 14 in your pack. Can we agree those are approved as a correct record? Agreed. Agreed, thank you. Moving on to item 3, monitoring items. Revenue budget monitoring 2022 to 2023 for the period 1st of April to 29th of December 2022, and that's pages 15 to 22 in your pack. And I'll ask Hazel Goodwin if you can speak to that. Thank you.
Thank you, Chair. The purpose of the report is to provide information on actual expenditure against budget for social work resources for the financial year 22-23. The period we're covering is 1st of April 2022 to 29th of December 2022. That's our financial period 10, and we're also providing a forecast for the year to 31st of March 2023. This is the third Revenue Monitoring Report Committee for financial year 22-23. If I could take you to section 5.1 of the report on page 15, the report notes that the probable outturn exercise, where we forecast the likely year-end expenditure position, has been completed, and the resource is reporting a break-even position at year-end after transfers to reserves of 5.635 million. And just to note that the transfers to reserves were approved at Executive Committee on 1st of February 2023. Section 5.2 of the report notes that the transfer to reserves has arisen from an underspend within adult and older people's services, and there are also expected underspends within performance and support services and justice services, which offset an expected overspend in children and family services. That takes us to an overall break-even forecast. Just to note that the Children and Family Services overspend is after funding of 6.5 million has been added already in 22-23. At section 5.3, we note there that the adult and older people position, which is detailed at Appendix C, shows the underspend of 5.635 million before we make the transfer to reserves. And I would note that also included within that position, there's a commitment to the Integrated Joint Board in relation to some specific funding, which we don't expect to spend in this financial year. That's 1.423 million. Again, the Executive Committee on 1st of February approved that the IGIB retains that non-recurring underspend within their reserves, and we've earmarked it for future care costs. Section 5.4, we also note that the adult and older people's position includes an underspend in core council budgets. That's at 5.635 million. The Integrated Joint Board financial regulations allow the council to adjust contributions in respect of unplanned underspends like this one. And again, the Executive Committee on 1st of February approved that this 2023 underspend is retained by the Council, and that's going to be used to help cover the Children and Family Services budget pressures into financial year 23-24. The way we do that is by also transferring that underspend to a Council reserve. As detailed at 5.5, that's the same approach that we adopted in 21-22 when again there was unplanned adult and older people's underspend retained by Council to help cover those children and families' budget pressures. We'll continue to monitor the financial position for the rest of the financial year, but as noted, after the transfer to reserves, adults and older people's services shows a break-even position. I've provided in the report appendices A through to E, that's pages 18 to 22, given details of the forecast year-end position in some detail, also the period 10 position. We've given detailed variance explanations there and also the proposed variants for each of the services. If I could refer members back to section 2 of the report, committees asked to note the forecast break-even position as at 31st of March after transfers to reserves. Note the break-even position as at 29th December after transfers to reserves, and also if we could approve the proposed budget variants, please. Thank you.
Thank you, Hazel. Are there any comments, questions? I don't see anyone. No. Are people happy to approve the recommendations in the report?
Agreed.
Agreed. Thank you. Moving on to item 4, it's the capital budget monitoring for 2022-23 for the period 1st of April to 29th of December 2022, pages 23 to 26 of your pack. And can I invite Lorraine O'Hagan to speak to the report, please?
Thank you, Chair. Good morning, Committee. This is the standard capital budget monitoring report for the current financial year, and it's the third report to committee this year so far. And in line with the revenue report presented by Hazel, it reflects the budget and spend position to the 29th of December 2022, so that's our accounting period 10. Section 3 of your paper gives the background to the report and explains how the budget was set for the year, and it's worth noting that there have been no changes to the budget since the last report to this committee back in November. Section 5 then details the main financial implications. Section 5.1 notes the resources total capital programme for the year is 3.903 million. In terms of anticipated spend for the year, current working projections show an overspend of 200,000, but that's purely in relation to the timing of spend on the multi-year community alarms and Swiss Plus replacement projects. As we note in section 5.2, the overall funding package for these projects is in place with an allocation into next financial year, so any overspend in the current year will be offset by the budget, and we'll bring that budget forward to manage the spend in the current year. Finally then, section 5.3 notes that anticipated spend was 3.551 million, with actual spend incurred to the 29th of December totalling 3.631, so we're £80,000 ahead of profile, and that actually reflects the timing of spend in relation to the Blantyre Care Facility project. The position overall of the projects is detailed in Appendix A in your pack. If I can then refer committee back to the recommendation in section 2 that the social work resources budget of 3.903 million and the spend to the end of December of 3.631 million be noted. Thank you.
Thank you, Lorraine. Any comments, questions? Don't see any hands. No. Are you happy to agree the recommendations in the report?
Agreed.
Agreed. Thank you. Moving on to item 5, workforce monitoring, September to November 2022, pages 27 to 34 of your pack. And can I invite Eileen McPake to speak, please?
Thank you, Chair. So this is the standard workforce monitoring information for social work resources covering the period September to November 2022. So section 4 outlines attendance statistics for committee, and the details are in Appendix 1. So the absence rate for the resource for November 2022 is 7.4%, compared to a council-wide figure of 6.5%, which is increased by 0.1% compared to the previous month, and compared to last year, the figure has decreased by 0.3%. That translates to a projected annual average for the resource of 7.9%, compared to the council-wide projected average of 6.0%. Moving on then, section 4.2 to 4.5, the details are all in Appendix 2, and the main points are that during the period there was 395 occupational health referrals, there was 4 disciplinary hearings, 1 grievance and no dignity at work issues were raised. There was 26 accidents or incidents recorded during the period, and there was 70 leavers and 41% of them completed exit interviews. Details of vacant posts are in Appendix 2, and there was 115 vacant posts during the period. 112 of them will be filled. 1 was held pending a review of the service, 1 the budget transferred to another area, and 1 the post transferred to another area. So I'm asking to refer committee back to section 2, and the recommendation is that the workforce monitoring information for social work resources for the period September to November 2022 be noted.
Thank you, Eileen. Any comments, questions? Don't see any. Councillor Brown.
Yes. Thank you very much, Chair. I just wanted to probe a little bit on the question of the pressures on the service at the moment. I mean, my anecdotal experience from casework and things has been there's been a number of issues in the period leading up to Christmas and for the month of January in particular on both care service, care at home staff and also on social work assessments. My impression is that that's improved a bit in terms of the speed with which people can be met. Can I have a bit of a feel of that? Are we, what's the extent of the pressure on the service? How are we doing on the recruitment front, if you like, in these 2 crucial areas? What sort of pressures does that continue to give us? Bearing in mind, obviously, there's a fairly high absence level behind that no doubt makes the whole thing a bit worse as well. Thanks, Chair.
Thank you. I'll ask Ian, can you?
Yeah, I can pick that up. So the system continues to be under quite significant pressure. So that there's a lot of demand for services. We still have kind of, I suppose, pent up demand from the pandemic period, as well as the kind of the day-to-day challenges. That's also being matched with workforce supply challenges. So across the partnership, whatever post you look at, GPs, AHPs, nurses, social workers, social care workers, there's challenges in terms of recruiting staff into vacant posts and trying to bring people in with the right skill set. Clearly, we've got activities on the way to try and mitigate those challenges. We've been doing a lot of recruitment activity. You may have seen a lot of material on social media, for example, around social care recruitment. So we are, in fact, bringing in lots of people into the service, but the age profile is we have retirals, we've created some additional posts, and people are getting promoted into new posts, so that there's a bit of churn from that as well. So it remains a kind of challenging position, but clearly the teams are doing all they can to be on the front foot around recruitment and trying to work our way through waiting lists and reduce waiting times as best we can do.
Do you anticipate there's a point at which you'll, if you like, break even on all of that and get on top of the thing? As I say, it did seem to be improving. But I just wondered if you anticipate on current rates, if by, I don't know, the end of March or whatever, there would be the capacity to cope, bearing in mind the end of the winter period and all that as well.
Yeah, I think we're talking longer term here in terms of the recruitment challenges. So we take something like care at home. We did receive an additional investment into the service, so that this committee has approved the creation of a number of posts, but it's proving really difficult to fill all those posts in the timeline that we want. So see what we've done, work around recruitment fairs, social media, videos of carers talking about how much they enjoy their work, trying to maximise the visibility of the broadest range of terms and conditions that we have to, but the supply isn't there. I mean, I I heard an article in the read this morning about the level of people in employment in Scotland being at the highest level ever. So that kind of statistic is working against us in some way in terms of being able to bring people into the workforce. So we have ongoing recruitment campaigns. We have some other irons in the fire in terms of how we might redesign jobs a little bit and make them more attractive. So I would say over the course of this calendar year, we'd hope to continue to make improvements, but I wouldn't be expecting to be major gains very quickly. I think there'll be an incremental improvement as we hopefully get some traction in terms of some of the activities we're putting in place.
Can I pursue one other angle, Chair, if I might, which is the issue of the absence rates? Now, clearly they've been higher in a general sense than the council average, and also higher than they were, I think, pre-COVID. But there seems to be a particular focus on the manual worker end of matters, which is over 10% there. This is very tricky because, as you say, you're dealing with an elderly, an ageing workforce in that regard. But I just wonder if there's any sort of features in that give us any scope for being able to, make some improvements in that.
Again, there's probably a range of issues in there. So one, as you've touched on, is the demographic of the workforce. So we have a predominantly older workforce around the social care, and there's probably a higher absence rate as a consequence. We're also increasingly focused on infection prevention control. Some of the learning from the pandemic period. So we really don't want social care workers who are under the weather, as it were, being at their work. We want them to be not infectious. So we need to be cautious about everyday kind of respiratory illness and all that. We're not bringing that into the workplace. So that's an issue as well. We also see elements of people waiting for diagnostic appointments through the NHS, waiting for treatment through the NHS because of the backlogs in the NHS system. So someone may be off with a very, perhaps waiting a surgery for an ailment, and they're waiting longer than they would have normally. So when we might have seen them back to work in 3 to 6 months, their duration of their absence is extended, which is clearly not good for them as an individual, but not good for the service either. So there's a number of kind of factors all kind of coalescing around that figure.
Yeah. Thank you very much indeed.
Thank you. There's an IGB annual report, and various performance reports are available. But as Ian says, I think it is going to take some months before the impact of all the various measures and resources that have gone into winter planning, etc., are going to actually, take effect. So clearly these reports will, be coming to this committee and the IGB, and we can monitor the impact over the coming months. I've got Councillor Frame. Don't see anyone else. With that, do we agree the recommendations in the report?
Agreed.
Okay, thank you. Moving on to item 6, Social Work Resource Plan, Q2 Progress Report 2022 to 2023, and it's pages 35 to 60 of your pack. And can I invite Craig to speak to the report, please? Thank you.
Thank you, Chair. So people will be familiar with the layout of the report, and you'll see within there that the detail of performance measures attainment are included at 5.2. 5.3 goes into some of the highlights around the key achievements thus far, whilst 5.4 highlights the 2 areas that require some further improvement, and both of those relate to the community payback orders. You'll see that the first of these relate to being seen by a case manager within 5 days, and the second is starting placement within 7 days. And whilst we have narrowly missed the target, 72 of 75% in the first of those and 70 or 75% in the second, both of those measures are actually showing improvement from where we were last year, so it's still an improving position. And beyond that, I would ask that we note the recommendations at paragraph 2 around the progress report and the respective achievements and areas of improvement.
Thank you, Craig. I have Councillor Faulkner, Councillor Frame. Okay.
Hi, mine's just a quick question. At the last committee, I asked for an update if there was a survey sent out to the clients, the family members and the carers to see how the new system is working for allocating jobs. And I was told that it was going to be getting sent out to see if there's an update on that, please. Yes.
So is that in respect of the care home scheduling system?
Yeah, the scheduling system for allocating the carers their jobs for the day.
Yeah.
They were asked for that because there were certain people saying that when it had been brought in, it was bringing inconsistency, and there was no consistent care being provided, and certain clients were getting like 15 different carers, and there was going to be a survey sent out for it. And at the last committee, they said yes, they were going to send a survey out. So I was just wanting to see if there was an update on that, please.
Yeah, I haven't got an update on the survey findings, because it's an ongoing kind of project in terms of completing the rollout of the system and pulling staff into roles in terms of the scheduling teams. We do have regular discussions with the trade unions around the impact of the scheme on the workforce. We get regular feedback through the carers on the ground who are in the trade union group, and we meet with them regularly. So we've had fairly good feedback on that. The positives and the challenges, and we've followed up on all of the challenges to make sure we're getting in amongst it. I mean, the whole intention of the scheduling tool is to make sure we deliver consistent care and efficient care. So we're very alert to concerns about multiple carers going in and inconsistent teams. So we have received regular feedback on that and are following that up. So we will continue to do that, and we'll follow through with further engagement in due course. So, I mean, if it would be helpful, we could pull that together into a kind of a briefing note, if that would be a useful way of just kind of summarising where we've got to and the next steps. Yeah.
Thank you. Thank you.
Councillor Faulkner.
Thanks, Chair. Just two questions, one on page 54 and one on 56. At the top of page 54, action, measures, comments, progress. By the end of November, with all care staff employers returning to building bases. That doesn't seem to have happened, because I visited St Andrews in my ward last week, and I was greeted by an NHS worker who told me that they were doing training in there. We're being asked to approve a report that's contrary to what's actually happening.
Okay, so in terms of the day services, we've got a number of registered services which operate traditionally from a range of buildings. We've been able to reinstate all of the services. So the service that ran from St Andrews is currently operating from a different building, and the reason we're doing that is to do with additional requirements around infection prevention control and to do with overall kind of staffing availability. So what we've done is consolidated the services within some but not all of the buildings. So the service is fully delivered, as it were, within the workforce available, but not necessarily from the building it was in before.
Follow up to you. Well, if we look at it, it says all care staff returning to building bases. So where we've moved them, are we overstaffed there? Because the staff is St Andrews, aren't they in St Andrews?
No, but what we've done is move the staff who deliver that registered service and the service users within that registered service into another building where there's capacity. So if, for example, we have more than one service now running out of Fairhill in Hamilton, so we've got two services that were in two separate buildings running in the one building, but still two separate services. You've got the learning disability service, you've got the older people service with their own discrete staff teams working from the one building, but we've got shared arrangements around housekeeping staff, for example, because there's new infection prevention control standards, and to fully deliver them within all of the buildings would require a significant additional sum of money to recruit more staff to deliver on that. So we're currently working our way through the implications of that, and we'll bring that back to committee in due course.
Follow up to you. Just in regard to that, I mean, when they opened the Newbury Centre, there was issues that elderly people were moving from Fairhill to the Newbury Centre and the travelling distance and elderly people being in buses. So we've moved the people that use the Hill House Centre to the Newbury Centre on Bothwell Road and left the Hill House Centre empty, though we've got the staff to maintain it.
Well, the point I made is we don't have the staff to open all of those buildings because we don't have all of the domestic staff that would be required to deliver on that. So there's an additional ask, a statutory regulatory requirement in terms of meeting infection prevention control standards, which could only be met in all of those buildings by finding additional budget to recruit additional staff to fully deliver on that. So we've sustained the services for those service users with the available staffing within the building base that we have, but we're operating from slightly fewer buildings than we did pre-pandemic.
Okay. Page 56, Chair, okay. Page 56, the top. Measures, develop measurement plan which tracks progress and implementation of the Home First model. The Home First model, maybe getting my age away, seems very much like the reablement model, where people come out of hospital and we double the amount of workers in to get them back on their feet. How does that tie in with the hub at Blantyre, where we're putting people in a halfway house and before they go home?
So we need to see both models as part of the concept of intermediate care, and intermediate care isn't just one thing, it's a spectrum of services. So you're quite correct that Home First in one element is a reablement style model where you've got a care at home team who are working on helping the person to regain skills, to learn new skills, to be as independent as they can be, and they'll be supported by nurses, EHPs, social work assistants to complete assessments and so forth. So that's part of the new investment I touched on earlier. So we're bringing in some infrastructure and additional carers, refocusing some of our existing resource into that kind of model. So that's one part of that spectrum of intermediate care. The Blantyre hub then delivers a bed-based version of that. So you've got people who have maybe got higher dependency needs at that moment in time. So it's perhaps not safe or sensible to take them straight back to home. So we can provide a better reablement experience within a bed-based unit for a few weeks. And the evidence we've got in Candareven is the majority of those folks recover to a position where we can then get them back home with a support package where they remain, and that's the place of choice. And for some people, the time in the Blantyre hub will allow them some time to consider their situation and whether going home is in fact the right thing for them. And one or two people will then move on to residential or nursing care. So it's a fairly modest proportion of the residents who've gone through Candareven have gone on to residential or nursing care, and we expect that to be mirrored, broadly within the Blantyre service when it's fully up and running.
You just mentioned the Blantyre hub there. Is it open yet?
So we're moving towards opening. I think we said at a previous committee we were aiming for February. We've obviously been in the midst of winter pressures with our acute hospitals being busier than they've ever been, and we're also about to embark on Operation Flow, which you've probably heard of, which is an exercise between the acute sites and community to decompress the hospitals over the next couple of weeks. So given all of that on the go, we're probably now looking at shifting the opening date for Blantyre back 2 or 3 weeks. So we're now looking at probably early to mid-March as the point where we'll take in our first service users, but we have done a lot of the work in the background about, the places get furnished up, the staff are there, the staff are being trained up, so we're on the cusp of being ready to open, but we just need to make sure we're not creating additional risk at a time where we really need to focus on sustaining capacity in the system to deal with the ongoing winter pressures and that kind of decompression of the hospital. So once we move through that exercise in a couple of weeks, we'll then move into opening Blantyre.
Chair, will you indulge?
One more point, Alan.
Thanks very much. It's just on the Blantyre hub being bed-based. Have we learned nothing for Rose Park or Grenfell? We're putting bed-based people in an upper floor who've got mobility issues. which I find quite surprising, especially when we spent £8.6 million on it.
Well, I can assure you that the building is fully compliant with all the building regulations. It's got multiple points of exit. So, the council has followed all the rules and regulations in terms of the construction of that building, bearing in mind the service user group that's within it. So, I think we can be assured that the building is as safe as it can be.
Okay, thank you, Alan. Councillor Brown.
Yeah, just a very small point, Chair, if I may. On page 54, there's a report mentioned about the See Here Strategic Working Group work plan going to senior management. I just wondered, the flavour of that would be of some interest, I think, to the committee. And I just wonder if there was the outcomes of that might be something that might come back to us at some point to know a bit more about. We've had a few motions at council over the years about various aspects of these sorts of things. I think it was quite of interest to members, that one.
Sorry, technical hitch there. I'm delighted to bring something back in due course.
Thank you.
Thank you. Councillor Logan.
Oopsie-daisy. Thanks very much. This actually should have probably followed on from my colleague Councillor Frame's questions. When you put your surveys out, etc., it's easy for us to survey the clients that our staff deal with, but is that also going to go to everyone who has external contractors, like care contractors in their home? Are we going to survey that as well? And when it comes back, accepting that, you might do a briefing note, but we here in this committee, but there's, I'm assuming that problem, people saying about, multi people coming in every day, etc., will be in every councillor's lap. So if it's not to be an agenda item but a briefing note, I'm assuming that you will then send that to every councillor on the council, because it is something that does come over your desk on a not a regular basis, but on a basis. So will the survey cover every client that you have? And my other point, I was just listening to Alan there, Lockhart Hospital in Lanark, and I know it was GP based, but I know that there was extensive work done at the pandemic and then it never was really used again. But if your model in Blantyre proves that, well, that's a good model, you get people, you can put them into that situation, get them ready for wherever they have to go, either home or, as you say, to make their choice for their future. Would something like that, say the Lockhart, in a different setup, no based on GP, would that not be of any use to us, especially out in the rural area? Because if your model works here, would it not work equally as up in our area, where, well, it'd be very difficult for people to visit or travel away to Blantyre. So I'm assuming that most people that would get into Blantyre, maybe not, but would be based round about there. But say if the model could be transferred, because I know there was a lot of work done just recently during COVID. Thank you.
Yeah, I can pick up on both those points. So in terms of talking to the external providers, we do undertake surveys with them from time to time. So we quite straightforward, I guess, to extend the survey of service users to the independent providers as well, just to kind of pick up on any issues and concerns. We obviously will monitor that sector as well, and we do follow up on any issues that arise. I think we do need always accept there'll be some element of change in carers. So whilst you may have a steady team, people still have leave, people are still absent, people move on. So there's always a degree of churn, but the aim is to kind of keep the number of carers down to the minimum necessary group that are required to provide the care. And some of the work we've been doing in our own service is trying to create a peripatetic team as well. So we've got a group of carers who cover a particular neighbourhood, so if you have cover required for holiday, it's the same group of staff who are providing that cover, so that's one of our recruitment challenges, is maintaining sufficient supply of those groups of staff. So that's all work underway, and we can certainly extend the survey. In terms of the Blantyre Hub Lockhart site, really what we want to do is get Blantyre fully up and running, learn the lessons from that. We've had the director of the Wishaw site and the chief of nursing out to Blantyre to have a look at it and engage with them in terms of that kind of flow of patients from Wishaw Hospital into Blantyre, as much as we're pulling people in from here Myers. And that'll be one of the areas for us, I think, to work on going forward, is that kind of pathway, effective communications, effective referrals between the acute sites and the Blantyre hub for those folks who need kind of bed-based support. So I think that would be the first step and stage. And once we review that and just work out, the level of need, so is the hub got sufficient capacity for all of South Lanarkshire, or is a model a success and we've got people who are not getting into it, as it were, and we need to have a look at whether we need to build extra capacity. But I think that's probably one for us to look at in maybe 18 months' time or so, once we've actually had a look at the performance of the new hub and just who's coming into it and the throughput.
Okay, I don't have any more hands. Can we agree to the recommendations in the report?
Agreed.
Thank you. Item 7 is the update of the 2022-2023 Risk Register and Risk Control Plan, and it's pages 61 to 72 in your pack. And can I invite Craig again to speak to the report? Thank you.
Thank you, Chair. So members will note the 5 main areas of risk which are highlighted at paragraph 4.1, and there's further detail against each of those provided at Appendix 2. 4.3 also lists some of the other ongoing risks which we are managing beyond those that are classed as high or very high. And I would also bring members' attention to paragraph 5.1, which is the review that's been undertaken by Gallagher Bassett around health and safety training. And that is an area that we will be carefully assessing the impact of any of our own staff, and we will in due course bring a further report back on the findings as they relate to this resource. And I would encourage members back to paragraph 2 around the recommendations to note the content of the report and the associated top risks. Thank you.
Thank you, Craig. I don't see anyone wanting to speak. Can we agree the recommendations in the report?
Agreed.
Thank you. Moving on to items for decision. Item 8 is reinforcing capacity, social work planning and performance and community justice services, and it's pages 73 to 78 in your pack. And can I invite Liam Purdy to speak to the report, please?
Thank you, Chair. Chair, just to advise you that Gillian Booth, who's the service manager for this team, is going to present this report, and she's online. Thank you.
Today is to update the committee on the additional funding allocated to justice services and the third sector from the pandemic recovery monies from 2023 to 2027. Also to seek approval for the justice posts as detailed in section 7.1 to be added to the establishment on a permanent basis. Also to seek approval for the 2 peer support assistant posts that are added to the establishment for a 2-year period, detailed in section 7.2. And to seek further approval to extend the MAPA Level 1 Administrator post for a further 2 years as detailed in section 7.2. At section 3, you will note that it is the intention of the Scottish Government to retain the current level of funding for justice social work for the remaining part of the spending review in 23 to 27. The posts noted in 3.1.3 were created on a fixed term basis and have been continued to March 2023 in justice. It is proposed that all these posts are substantiated on a permanent basis to justice social work. Financial costings have been illustrated in section 7. Section 4 outlines our two 18-month fixed-term peer support worker posts, which have previously been funded from the Drug Death Task Force via CORA. Current research, namely the Drug Death Task Force Changing Lives report published in 2022, evidences that peer support and mentoring plays a vital role for people with substance use issues and should be at the heart of the development of delivering statutory services. This approach is embedded into the South Lanarkshire Alcohol and Drug Partnership Delivery Plan for 2021 to 23 and our ADP Justice Workstream, with a commitment to developing co-produced services with those with lived and live-in experience. Given the current demand for this service towards the end of people's community payback orders, the continuation of this service is essential. We propose a further 2 years fixed-term funding for these two posts. Section 5 outlines a current full-time equivalent clerical MAPA assistant post that was agreed at committee back in March 2020. It was previously evidenced that over recent years there's been a significant increase in the volume of MAPA Level 1 referrals, and it's outlined in 5.16 over the period from 2019 to 2022. And you'll see those numbers have gone up. And they've continued on a yearly basis to increase, and we project this to continue. It is understood the expectation of information sharing, joint working and collaboration at an interagency level remains high with the Level 1 cases, and it's also of note that the majority of initial and significant case reviews are generated from MAPA Level 1 orders, both locally and nationally, and as such there is a requirement for robust defensible decision making evidenced through formal minutes. Given this, we would propose to continue the funding from the Section 27 grant for a further 2 years. I would refer the committee back to the recommendations in Section 2 and ask the committee to note the contents of the report and approve the recommendations that the justice posts are added to the establishment on a permanent basis as detailed in 7.1, and also to approve the addition to the establishment of the 2 peer support assistant posts and the MAPA Level 1 administrator post for a further 2-year period as detailed in Section 7.2. I'm happy to take any questions.
Thank you, Gillian. I don't see any hands up. Are we happy to agree the recommendations in the report? Agreed. Thank you. Moving on to items for noting. Item 9 is the Chief Social Work Officer Annual Report 21 to 2022, pages 79 to 122. And can I invite Liam to speak to the report? Thank you.
Thanks very much, Chair, and good morning, committee. The report is to update the committee on the annual Chief Social Work Officer report. You'll see at Section 3 within the report, it just restates the role of the Chief Social Work Officer, and that there's a duty to produce an annual report for the Chief Social Work Advisor of Scotland. Section 4 just gives some background to the Chief Social Work Officer report, which is attached at the appendix, and you'll see that the report is it follows a national template, and it's split into basically 4 sections. It covers governance and accountability, service quality and performance. It looks at resources across the service and workforce. And within the report as well, you see at the appendix there are data trends which are highlighted, as well as the care inspectorate grades on an annual basis. In relation to the report as well, just to highlight a couple of points within it, at 4.4 you'll see reference to service quality and performance arrangements. And what you'll see throughout that period, we've now established a corporate parenting board, a promise board and a champions board. And that was seen as one of the deficits that we had during the inspection 2019-20. And you also see within the report in the appendix that we still have the inspection action plan, which we're pursuing. Just to note as well that all care inspectorate inspections are now fully up and running as well. At 4.4.6, we've highlighted some bullet points from the report, and that's just to reinforce some of the challenges that we had through 21-22, which are actually still ongoing today. A couple of ones just to pull out for noting is the affordability of services is going to be one of the biggest challenges we have going forward, and the increased cost of living, which was not, it wasn't planned for, and that's come at us with quite a pace. Other things to note within the report as well is just some of the trend data, and you'll see that it's been a 4% increase in the number of looked after children throughout that period. And what you'll also see as well is there's increased adult support and protection activity. The last bullet point on that list actually references the unprecedented pressure that health and social care have had throughout that period, and that pressure is continuing, and as you've heard already, there is a pent-up demand that is still within the system. And one of the biggest challenges we have is about the recruitment and retention of staff, and you'll see within the report that care at home staff has been one of the biggest challenges that we've had, and there is a recurring recruitment and retention issue that we have there, which we are trying to address. In relation to other points within the report, just in relation to 4.7 key priorities for recovery, it's worth noting that during the pandemic we've actually looked at new methods of working. Very much we're now an agile workforce, and whilst offices are now opened and building-based services are now up and running, we actually are now maximising the use of agile working and new technology, and this has brought a benefit that we've seen throughout the pandemic. At the back of the appendix as well, you'll see there's performance data and the care inspectorate data as well for that period. And if we can just take members back to the recommendations at 2, it's for the report to be noted, and happy to take any questions. Thank you.
Thank you, Liam. I don't see any hands. Could I thank you, though, for what is a very comprehensive report and a very clear picture of the landscape across social work, including the challenges and the work that has been done over the past, difficulties with the pandemic and the recovery process, and as you see, the different ways we now have of working. It gives a very clear picture of that. So I would certainly recommend, if you have time, to study some of it, because, as I say, it gives an excellent picture of the landscape we're now in across social work. Thank you, Craig. Can we agree the report? Agreed. Thank you. Moving on to item 10, update on the work of getting it right for South Lanarkshire's Children's Partnership, and it's pages 123 to 160. And could I invite you again, Liam, to speak to the report? Thank you.
Thanks very much, Chair. Committee, this is an update on the Getting It Right for South Lanarkshire's Children's Services Partnership. I refer to it as the Children's Services Plan because it's a bit of a tongue twister. You'll see within the report as well at section 3, it's just to reiterate that there's a statutory requirement for health and council services to produce a children's services plan on a 3-yearly cycle. Our report comes to an end in March 2023, and our new cycle starts on the 1st of April 2023. It should be noted that since we produced the previous report, there were other national key priorities that have evolved, and we had to incorporate them into our existing report, and that was primarily the independent care review and the launch of the Promise. It was about community access to mental health services. It was about a whole family wellbeing approach, and it was about the UNCRC rights of the child, which will be incorporated into future reports. Section 4 just gives a background to the Children's Services Plan update, and you'll see within the appendix that we've got the annual report for reference. Within that, you'll see that there are 20 priorities, and what we've done is we've highlighted examples within those 20 priorities of progress that have been made over the past 3 years. I've highlighted a couple of things within the report as well, which I'll not go into detail, but are there for you for noting, and that is the Promise and our commitment to the Promise across children's services within South Lanarkshire, the whole family wellbeing funding and the UNCRC as well. And we've also looked at reference to the community access to mental health supports within the community. And at 4.8.4, you'll see where we've actually evolved and developed services. In relation to the next steps for the report, at section 5, you'll see that we've got multi-agency partnership and engagement sessions that are taking place. And that's, we're looking at a joint strategic needs analysis for the report going forward for 2023 to 2026. And there's various steering groups and working groups that have been established to develop the new report going forward, which will come to a future committee. As I said, the appendix for the annual report is attached for the 2021-22, and if I can refer members back to section 2 of the report, and that the report is noted. Thank you, Chair.
Thanks, Liam. I don't see any hands or questions. Can we agree to the recommendations in the report? Agreed. Thank you. Moving on to item 11, the South Lanarkshire Justice Social Work Community Payback Annual Report 2021 to 2022, and it's pages 161 to 172 in your pack. And can I ask Liam again to speak to the report? Thank you.
Chair, thanks very much. I'm going to delegate this again to Gillian Booth, who's the author of the report, and Gillian again is online. Thank you.
Is to notify the Social Work Committee of South Lanarkshire's Community Justice Scotland Community Payback Order Annual Report for 2021 to 2022 and to highlight the main themes and trends from this report. South Lanarkshire Community Justice Scotland Community Payback Order Annual Report is available to read in Appendix 1 of this report. Community Justice Scotland will publish online a national summary after the 31st of March 2023, after it is laid in Parliament. South Lanarkshire Children and Justice Services will publish their report thereafter. In addition to the main themes and trends from this report, I would highlight the following. In respect of unpaid work services, the annual report highlights the positive work that has been undertaken in relation to ground maintenance, gardening and fence repairs, among some other activities. This work includes the Winter Jacket Appeal, working alongside community and enterprise to benefit school children within the South Lanarkshire area. There is a focus also on our new system of recording outcomes for service users on supervision. This has developed 10 areas of improvement, including desistance from offending and substance use. While the data available for this reporting period is limited to 107 community payback orders completed, it does evidence the positive outcomes people subject to supervision and justice are achieving. We've included feedback from service users which demonstrates the impact of relationship-based practice during what was an extremely challenging period, having still been in the COVID pandemic. This report also references future innovation going forward in Section 7. This includes our whole systems approach service for 16 to 21-year-olds, which commits to the vision of the promise through supporting our children and family services with complex and high-risk young people. This includes supporting young people in conflict with the law who are not on statutory orders but currently subject to compulsory supervision orders from the Children's Hearing and Secure Care. At the time of writing this report, initial discussions took place with North Lanarkshire Justice Services, Sheriff Principal, Addiction Services and Pan Lanarkshire community partners. And we've had discussions around about developing a dedicated alcohol and drug court in Hamilton Sheriff Court. I can confirm that we've had agreement in principle from all our stakeholders to go forward with this, and we are now awaiting the outcome of CORA funding application, which is due to report back in April 2023. Lastly, in Section 8, we report our performance measures. The resource plan performance indicators have evidenced two main areas of improvement activity that require focus on over 21 and 22, and that was in relation to service users that had their unpaid work induction within the 5 working days and paid work placements commencing within 7 days of the order being imposed. These figures need to be considered in the context of the COVID pandemic, and which through South Lanarkshire Council's social work self-assessment and improvement activity annual review, a number of actions have been taken forward to improve on induction and placement commencement. I would refer the committee back to the recommendations in Section 2 and ask the committee to note the contents of the report and approve the recommendations. That the content of South Lanarkshire Community Payback Order Annual Report is noted, and happy to answer any questions.
Thank you, Gillian. I've got Catherine.
Thanks, Chair. It was just to say to thank Gillian for the report and to thank her for when Margaret and I both visited you a few months ago just to see what was happening in your service. It was actually quite overwhelming to hear what the things that you are doing and to speak to the service users, especially to hear their views as well and how well you coped during COVID and how you managed to just change the service around to suit COVID conditions. And I know from my own ward, the work that you do is very helpful to the community, and keep up the good work, and thanks very much. Thank you.
Thank you, Councillor.
Thanks, Catherine. I'd just obviously like to echo Catherine, so I thoroughly enjoyed the visit, and it's very uplifting to go out and see the standard of the staff, of the people and the work that's been done, and the talent that we have out there. So, and we hope, obviously, over the coming, however long we're here, to be doing a lot more visits. So thank you very much, Gillian. I don't have any other hands. Can we agree to the recommendations in the report?
Agreed.
Thank you. Item 12 is the joint inspection of adult support and protection. It's pages 173 to 176. And I'll invite Ian to speak to the report. Thank you.
Thanks, Chair. So this report really just gives the committee an update on the thematic inspection of our adult protection services. So the inspection took place at the latter end of last year and was considering how the different agencies, social work, NHS, Police Scotland, etc., work together to keep our citizens safe. The core focus of the inspection was around a position statement that we provided, where we identified what we thought were our strengths and areas to work on. There was a staff survey done, and the staff survey, I think, was one of the best supported that they've encountered. There was a really excellent response from our workforce to completing the survey, which the inspectors were very positive about. I also undertook file sampling and file reading to just test out the quality of the work. So the inspection process went well, and I think we've got a fairly positive report coming through as a consequence of that. So there was a number of kind of strengths identified by the inspection team in terms of the work across South Lanarkshire. The inspection was done concurrently with inspection in North Lanarkshire, reflecting the fact that the Police Scotland boundaries, NHS Lanarkshire boundaries are kind of coterminous with both authorities. So there was kind of read over there in terms of the activity. The inspection process identified 4 areas for improvement, and they pretty much reflected the areas for improvement we'd self-identified through our position statement, and things like working on chronologies. We're already addressing that through our implementation of a UIT system to make that a more straightforward process for the workforce, and there's work ongoing through the Adult Protection Committee and through the Resources Owned Improvement capacity to address those issues. We've recently submitted an improvement plan to the Care Inspectorate as a standard practice, and that'll be what we'll work on over the next period of time, and the inspectors will come back and have a look at our progress on that until we've got those issues to a conclusion. So really looking for the committee to note the content of the report and the process for implementation of the improvement plan as outlined in section 2. Thanks.
Thanks, Ian. I don't see any hands. Thank you for that report. And are we happy to agree the recommendations?
Agreed.
Agreed. Thank you. Item 13, Care Inspector updates for registered social work services. It's pages 177 to 182 in your pack. And can I invite Liam to speak to the report? Thank you.
Thanks very much, Chair. Committee, this is the report which we bring on a 6-monthly basis of care inspection updates for the committee, so they're cited on them in real time. The reports to be noted, you'll see it's section 3 in terms of background. Just to note as well that we've got 2 new services which are now registered within South Lanarkshire, and it's 2 Home First services, and that's in the East Kilbride, Rutherglen and Clydesdale in the Hamilton area. Ian's made reference to the thematic inspection of adult support and protection, so I'll not go over that within it. But in terms of recent activity, it's section 4. You'll see at 4.2 what the grades are currently across the service. And what you'll see is that we've got 5% rated as excellent, 88% good and 7% is adequate. We have no weeks at this stage within this period. And Appendix 1 gives a breakdown of all the inspection grades across the service. You'll see at 4.3, we've actually only had 1 within this period where that has been inspected, and that's the care home for the elderly, and it's David Walker Gardens, and you'll see that it's been consistent 5s and a 4 for leadership across the board there. There have been subsequent other inspections, but they didn't come through in time for us to get to this committee, so they'll be reported at the next committee. So the grades are attached in the appendix, and just to note the report for the committee, and we're happy to take any questions. Thank you, Chair.
Thanks, Liam. I've got Councillor Faulkner.
Thanks, Chair. Page 182, Care at Home services. I notice that all the services seem to be 4s or 5s, apart from Hamilton, which in the 5 care categories is 3, which is adequate. Some of my older colleagues will remember in the last administration we had a moratorium put in the Hamilton Care Service. Is there any improvement done here? I mean, 3 is adequate. And could I ask, see the 4 areas, are they all using IT mobile? Because one of the questions asked, how well is care planned? Thanks, Chair.
Chair, I'll start this off and you can give a bit more technical detail. I suppose what we need to do is remind the committee that the Hamilton Care at Home service there was an improvement notice put on them, so it was less than week, it was unsatisfactory. So during 2021-22 there was an improvement plan that was put in. The care inspector scrutinised it again, and we get the grades moved from an improvement up to satisfactory, which is 3s across the board. What we should say, and it was previously reported, that that's quite unprecedented, where you would jump up 2 or 3 grades within an inspection. So that shows the progress that was made within the Hamilton area. The moratorium was lifted in 2021, and that was after the improvements within the service. And what we're doing is that we're not resting on our laurels. There's still work that has to be done. And primarily what we need to do is look at the recruitment, retention of staff and the training within that area. In relation to the technical question about the use of the IT, I'll probably defer that to Ian to respond.
Yes, so in terms of that question, the scheduling software has been rolled out across the entire service. You know, the last area to have the rollout was East Kilbride, and that's completed, and we're just kind of consolidating the staffing arrangements. But that's one of a number of improvements that we agreed with this committee and with IGB around care at home. So we've moved from an arrangement where we had a scheduling which was done Monday to Friday, 9 to 5, broadly speaking, for a service that operates over 7 days a week. So we've now got staff who work 7 days a week from early in the morning through late in the evening. So there's better capacity for scheduling. There's better support for our workforce out in the community. We've also invested in assessment and care management posts to help us improve upon the support planning issues that the care inspector had identified, and we've done a lot of work around kind of quality assurance and training as well over the period. So we're confident that we'll see further improvements in grades around care at home, but because of the pandemic period and the prioritisation of care homes, have not yet come back to have a look at our care at home services. So I think we actually would welcome the care inspector coming back to examine the work we've been doing, and hopefully give confirmation we're on the right track and we're continuing to make improvements.
Okay.
It's on the IT mobile. Myself and several of my colleagues who met the care at home staff in the banqueting hall prior to their appeal for their regrading, which for some time seems to take longer than the Ferries report. But a lot of the staff there mentioned IT, and as you know, Ian, I've continually raised the IT mobile. And are you still as convinced this system is working really good?
Yeah, so we are convinced that this is a good investment and will help us to manage our care at home services more effectively. But I mean, you have raised, and I've heard feedback before about carers being concerned about their schedule being changed at short notice. But that's the entire purpose of the product, is to allow us to maximise the impact of the care staff we have available. So it's a dynamic scheduling system, so as people's needs change. So if someone is admitted to hospital, for example, we can quickly take them out of the schedule, and if we have somebody coming out of hospital who requires care, we can reschedule the carer to attend to that area. So we're trying to schedule when obviously a world, as I say, in the product. So we're working within kind of neighbourhood patches, so the same group of staff are working in the same area on a regular basis. But the whole nature of the product will allow us to kind of adapt and redirect our workforce where they're most required. But one of the parameters we have put in to pick up on an earlier question is to minimise the number of carers going into any one individual's house. Now, clearly it's a new product. There's been ups and downs. There's been learning. So we've been trying to address that and move that forward. So as the product becomes embedded, we're confident that will give us a better overview of our staff. It'll be a safer position, because we now know, for example, if someone's not attended a house when they were expected to, So there's a risk there for the service user, but there's also concern about our member of staff and are they okay, and so we can follow that through. So in the round, this product will give us greater functionality, better oversight, and give us confidence that we're being as efficient and effective as we can be in terms of the scheduling of the care.
Okay, I don't see other hands up. Could we just acknowledge the areas of improvement, and that will be obviously reported back to the committee, but also to note that most grades were very good and excellent under very, very trying circumstances, including all the issues we spoke about in terms of, staffing, recruitment, cost of living, all the rest of it. So we would also note that as a very positive aspect of the report, and thank you for the report. Liam, the next item, do we agree the report?
Agreed.
Agreed, thank you. Next item is urgent business. I don't have any items of urgent business. So could I thank everyone for attending and participating, and could I thank the officers for the very comprehensive reports that we have discussed today, and also thank Tracy and Catherine. Thank you. Have a good day. Thank you.